right, Dr. Kate, we have a frequently asked question, and this is probably something that you hear often during new patient exams or consultations. What is your recommendation for a children's vitamin that is not a gummy, and where does that guideline fall?
Oh, that is a very good question, and one we talk about a lot in the office. So my recommendations on this have actually changed a little bit since having kids. So this is one of those times where I feel like you get the education of the pediatric dentist, but then you also get the real world experience of having being a parent. And so my first thing is that make sure your child really needs a vitamin. A lot of the time, the vitamins that you're getting in a multivitamin, a gummy vitamin, or a like chewable Flintstone tablet, you could get just by eating a well-balanced diet. And a lot of our friends that are pediatricians and that we work with have told us that if they're getting a balanced diet, there's not any reason that you necessarily have to take a vitamin as part of your daily supplementation. Now, if it's something where maybe your child is lacking in some components of, I have a 2 and a 4-year-old, so I know what a toddler diet can look like.
No vegetables.
No vegetables. Or if it's something where you feel like it's an important part of just boosting immune response and things like that, we have a couple of recommendations. One is making sure that whatever you're taking, be it a chewable tablet or a gummy vitamin, that you're brushing right after, because so many of them have sugar in them and they do get stuck in the grooves of the teeth or in between the teeth. And what we find is a lot of people hand them to the kid on the way out the door, and then they run off to school, and then they're not eating anything to brush it off the teeth. They're not drinking anything to get it off the teeth, and they're certainly not brushing their teeth afterwards. So we would actually recommend doing it as part of breakfast and then brushing afterwards, or part of maybe dinner even and brushing after that and flossing after that. If you can find a sugar-free vitamin, that would be awesome. I have scoured the depths of the internet and have not found a great one to recommend quite yet. I went so far as actually making my own, still working on that, patent pending. And then, but my other kind of recommendation for that would be, if you're going to do a vitamin, the chewable ones still stick in the groove, so make sure you're kind of checking your children's teeth, and if there's any color, that's what needs to be brushed off. But there's 2 different types of gummy vitamins. There's a kind that is made with a vegetable-based, like gelatin, which or like it's called I think it's called pectin, and then there's another kind that's made with actually like gelatin. One is like if you pull on each sides of it and you pull apart, you'll see a string. The other kind will be a clean tear. Aim for the clean tear, if that makes sense, because the clean tears don't stick around as long on your teeth, whereas the ones that are made from the vegetable-based gummy component are the ones they end up being really stringy, and they will stick on the biting surfaces of teeth for quite some time. So that would be my recommendation. If you can avoid it, I would avoid it. If you choose to use it, that's fine as well, but I would, if you can find a sugar-free one for the particular thing that you need. Like, I know that there are some probiotic ones that are sugar-free, but I just haven't found a great multivitamin one that's sugar-free. And then if you are going to do it, just making sure you're brushing and do it with a meal and brush and floss right afterwards, so it's not sitting on the teeth. And then if you're going to find a multivitamin, I would aim for one that has a more clean-cut gummy made with gelatin than one made with pectin. That's my recommendation.
Perfect. Thank you.
That was really long, wasn't it?